This is Professor Okonkwo. Um, I'm a biochemist with a graduate training in forensic chemistry. I am an internist, a kidney specialist, and solid organ transplantation specialist, consulting in pancreas and kidneys. This video is a community service and it's on mental illness. I've practiced emergency medicine for 32 years, and I have seen mental illness in emergency department in many forms, and it's a very serious and devastating illness. And I want to state categorically that mental illness is not a crime. It can affect anybody at any age. It should not be stigmatized. It is not caused by the patient nor the family. Mental illness emanates from either the brain or from the rest of the body, because there are many factors that can precipitate mental illness, and there are different kinds of mental illness. Mental illness does not respect any demographics. It does not spare any family, any country, or any profession. In fact, let me be clear in making sure that the community understands this, that the people who are trained more than anyone else to deal with mental illness are the psychiatrists, and there are different subspecialties in psychiatry. But among all professionals, doctors have the highest rate of suicide, and usually comes from mental illness. And among the doctors, the last statistics I saw reveal that the psychiatrists commit more suicide, as well as the dentist, within the profession of medicine. So if those that are trained to recognize and treat mental illness are still affected by the same disease, we should all recognize that it should not be stigmatized. It is not the patient. It's not the fault of the patient. It is not the patient that is bringing mental illness upon himself, nor the family. It is a very serious disease to treat. It challenges every society, every family, and requires all the empathy that we can muster, all hands on deck to combat it. If you look at what is going on in the country today, and you can extrapolate that to many other countries, it is less in some countries and more in some countries, and there are many reasons to explain this. But overall, mental illness can affect anybody at any time, at any age, in any demographic. Brain is part of the body and is part of the nervous system and requires a lot of energy to perform its function. It is a complex system, and the brain by itself is extremely complex, better than any computer, because computers are generated by information that come from the brain. At the end of the day, the computer cannot build itself. Having said so, it is important for us to recognize that mental illness can also come from other medical problems that has nothing to do with the brain. medical illnesses can cause imbalance in the chemicals that make the brain function. And then once the brain malfunctions, because it's the seat of intelligence and cognition, reasoning, and expression of the reason in carrying out functions. If there is chemical imbalance and the brain doesn't function well, then it affects the rest of the body as well as the individual. And then those that live with the individual and the society where the family of the individual lives. So it doesn't spare anybody. It is a problem of everyone. And therefore, particularly in countries like Nigeria, where people think if somebody has mental illness, oh, we have to blame the family or blame genetics. It is not the case. Mental illness can come from as a result of the environment. It can come from genetics, not purely because it's from this person's family. But there is a biomedical problem. There are certain medical illnesses. If you have those illnesses because of defect in the gene, which was not there originally when the family started. So somewhere down the road, as propagation continues over thousands of years, just like in any other disease, there can be a defect in a gene that will manifest deficiency of a particular enzyme or a particular substrate, which is like a molecule of substance that will help you make certain things in the body. And if those things are not present, then the brain will not get all the chemicals that it needs to function well. And so that can result in mental illness. It's not because of the person's last name. Mental illness can also come from medications. It can come from diseases of different organs. For instance, if somebody has tumor of adrenal gland, which is a small gland on top of the kidney, and you produce excessive cortisol, that can produce profound depression, and in some cases can trigger psychosis. So there are many factors that can precipitate or help cause malfunction of the chemicals in the brain to produce abnormal reasoning in an individual, and that can be diagnosed as a mental problem. There are milder forms like anxiety or depression. Then you can have serious ones or more serious ones like psychosis, going from schizophrenia to schizoaffective disorder, and etc. And then we find in people, in the past we used to think that dementia was a disease of old people. No, these days you can find dementia in people who are 50 years old. So we know that it has some things to do with environment. So in summary, mental illness can be caused by a whole range of factors, including diseases. But for whatever reason, most societies have seen it as something to be stigmatized. If somebody has mental illness, it's different from somebody who has diabetes or different from somebody who has a bone fracture. When somebody has type 1 diabetes as a result of damage to the beta cells of the pancreas in which the person cannot produce insulin, the person didn't cause it. It can come from autoimmune disease, and it can come from a virus. Or a child that is 2 years old or 3 years old that has leukemia. The child doesn't cause the leukemia. So the mysteries of life and things we don't understand about life itself should humble all of us to recognize the fact that no illness that impacts any community or any individual was caused by that particular individual from day one. Even things we can say, for instance, somebody who becomes an alcoholic and so down the road develops liver cirrhosis. We are going to say, yes, he's an alcoholic. He drank, that's why he developed cirrhosis. But why do you have two people, give them 1 cup of wine each? One drinks the wine and never drinks again, has no taste for it. Another person drinks the same wine and can't drop the cup, continues to drink until he becomes an alcoholic. Same thing goes with drugs. Am I saying there are no individual responsibilities there? No, but there are other things that play major roles to make that happen. Therefore, we should see all these things as diseases and treat them as such. Drug addiction, we used to see it as the weakness of an individual. Not anymore, because we have understood the science of it. It's a disease that needs to be treated. The same thing applies to alcoholism. Therefore, when somebody has mental illness, it requires the effort of the entire society. Families, church, schools, the government, insurance companies, all private sectors, because it affects all of us. I have a nephew who has schizophrenia. He was getting ready to go to college and he hit him. And he ended up not going to college. And one day he was having hallucinations. And he ended up in somebody's house, digging around this person's house, saying he was trying to remove the Satan from the ground. And the owner of the house saw him. Instead of recognizing he has a problem, called his community, and they began to plot on how to kill him, because they thought he was coming there to bury voodoo, to affect them. It wasn't until somebody came by and saw him and said, this person looks like the cousin of so and so. Let's first call him and see what. They called my brother, who said, oh, that's my nephew. No, he has psychosis, has schizophrenia. And that's what spared his life. They would have killed him. So before we jump into judgment of, first of all, we need to correct our ignorance in reference to mental illness. It's not a crime to have a mental problem. It's a disease. Like you have hypertension, you have diabetes, like you have broken bone. These are from other organs in your body. We don't say that somebody who has heart disease should be stigmatized. I'm not going to go and marry somebody from that family because they have heart failure. I'm not going to marry somebody from that family because they have diabetes or they have bone fracture. So we need to treat this mental illness as a disease and stop stigmatizing it, because without doing so, we are not giving mental illness the attention that it requires. The government is not supporting it as much as they should, because I see people come through the ER and we do psychiatric emergency certification, which is PEC, and then we commit them to a facility for 2 weeks, and then they're discharged. Some of them will refuse to take their medicine, not because they don't want to, but the illness is telling them don't take the medicine. Some can become violent because the illness is telling them to become violent. And some are refusing to take the medicine because some of the medicine are so sedating that it makes the person act like a zombie. Every time he takes the medicine, he finds himself just sleeping and sleeping and sleeping and sleeping all day. Who wants to sleep all day? And then we're quick to jump into conclusion and condemnation. Oh, he doesn't want to take his medicine. So government and the society should invest more time and more resources to finding the right medicine, finding the right method of treatment, because everything about mental illness it's not just medicine. Support given to the family, support given to the patient by the society will go a long way in creating a healthier mental health for any community. And again, no one is above mental illness. It can affect you at any time. If you are in doubt, go and Google dementia. No matter who you are, it can affect you. Nobody knows who's going to have dementia. And a lot of illnesses can manifest as mental illness. If it does not manifest as mental illness, some medicines you take can cause you to have a mental illness. Depression can come as a result of medication that you take for blood pressure. So this is an appeal to all of us to please appreciate mental illness as a disease that affects all people, all families. And it is not a crime of the family. It's not a crime of the patient. It's a disease. It's malfunction of the brain, and the brain is part of human body. Just as the eye can get sick, and the nose can get sick, the mouth can get sick, the heart can get sick, the brain can also get sick. And it is not caused by the individual, not the family. I hope this helps.